Part 2. A Journey Through the Hospital.
Well, this setting should be familiar, as most of us have spent some time in a hospital. But different sounds, new people, machines that you're not quite sure what they do, it can all take a little getting used to. That's why I'd like to show you the different areas you'll be in before and after surgery so they can seem a bit more familiar to you. Weeks before your surgery, you'll head to the pre-admission clinic.
Here, you will meet the anesthesiologist and other specialists to review your medical history, perform a physical exam, and go over any lab results with you. You will also be given instructions on your medication and told not to eat or drink from midnight on the day of your operation.
On the day of your surgery, you will be admitted to the preoperative care unit.
Here, a nurse will ask you questions about your health and prepare you for the operating room. The nurse may start an IV and give you some medication before surgery.
Next, it's time to go into the operating room.
This is where you'll meet your surgical team, the surgeon and surgical assistants, the anesthesiologist and his or her assistants, and the operating room nurses. Including you, there will be 6 to 8 people in the operating room.
After surgery, it's off to the recovery room.
Here, a specially trained nurse will be with you to manage your recovery from the anesthetic and ensure you are comfortable. You will stay here for about 1 to 2 hours.
And your last stop in the hospital will be here, the patient care unit. And here your team of healthcare professionals will include nurses, physical and occupational therapists, your surgeon, and your anesthesiologist.
In your room, nurses will check in frequently to help guide your recovery, make sure your pain is well managed, and help you reposition yourself in bed. Getting moving is essential for a good recovery. So the team here will help you take your first steps the evening of your surgery or the next day, and to do exercises to prevent your joint from becoming stiff. They will also teach you how to get around, use the bathroom, and dress yourself while keeping your new joint safe.
Once the team has seen that your pain is well controlled, that you have no serious medical concerns, and that you can walk independently, you will be able to go home. That's right, you'll be able to go home.